Hello, I am Michelle Smith, the Regional Practice Lead for the Research Department in Interior Health, and I'd like to welcome our webinar guests. We would like to respectfully acknowledge that Interior Health is situated on the traditional, ancestral, unceded territory of the Okanagan Nation. I would also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of these lands. Welcome to the 10th annual Okanagan Embrace Aging Month, and thank you all for joining us today. We're very excited. It's the 10th year. Embrace Aging is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan, Interior Savings Credit Union, and Interior Health. Embrace Aging Month was launched 10 years ago to celebrate and raise awareness about positive aging, and has once again organized a number of educational opportunities and events during the month of March. The sessions are designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve quality of life among seniors and their family caregivers. Our goal is to inspire everyone to embrace positive aging. I'd like to let you know that there's the closed captioned box can be moved to the preferred place by clicking and dragging it to where you would like to see. To turn it off, the closed captioning, select hide caption button on the menu bar. And if you're having just text in the chat box if you need some more assistance moving it if you don't like it. The questions, type questions or comments for the speakers in the chat box during the presentation, and we'll read the questions out at the end of the presentation, and you can enter them along the way as you go. Today's event is brought to you by the support of Embrace Aging Month. Today's session is Stigma, Dementia, and COVID-19 Insights from Social Media and Lived Experience. Our speakers are Dr. Juanita-Dawne Bacsu, Canada Research Chair, Tier 2 in Nursing and Population Health, and Assistant Professor, School of Nursing, Thompson Rivers University, and advocates for people with dementia and caregivers, Myrna Norman, Patient Perspective, and Wayne Hykaway, Caregiver Perspective. And I will now leave it over to our speakers.
Perfect. So the floor is ours now. So hi, everyone. Thanks for the fantastic introduction. It is truly a pleasure to be here. Today, our presentation is on understanding ageism and stigma of dementia during COVID-19 by sharing insights from my social media research and our lived experiences. I'm joined by an amazing panel of guest speakers and experts with lived experience from the EPLED team, including Mr. Wayne Hykaway and Miss Myrna Norman. All right, so let's get started. So here's a brief overview of our presentation. So here's a brief overview of our presentation. We seem to be having some technical difficulty. Myrna, can you hear me?
Now I can, yes.
Okay, excellent. We are good to go. All right, so here's a brief overview of our presentation and some of the topics that will be covered in the next 25 minutes or so. First, we'll provide a bit of background on stigma of dementia during the pandemic, and then discuss some of my team's Twitter research on stigma. And lastly, we'll wrap up with some time for more panel discussion and questions from the audience. So what is dementia? Dementia is an overall term for a set of symptoms that are caused by disorders affecting the brain, ranging from Alzheimer's disease to Parkinson's. We know that Alzheimer's disease is the most common type of dementia, as it accounts for roughly 64% of all dementias in Canada. Now, the COVID-19 pandemic is taking a serious toll on people with dementia and their care partners. Studies show that dementia is the most common comorbidity in COVID-19 related deaths. Increased age, frailty, and chronic conditions often associated with dementia increases the risk of severe complications. Now, during the pandemic, there has been significant media coverage about the COVID-19 risks to older adults. Unfortunately, much of this coverage has amplified issues of pre-existing ageism and stigma against people living with dementia. Now, I'm interested in hearing from our panel of experts, Wayne and Myrna. How do you feel the media coverage of the pandemic has contributed to stigma of dementia? Have you noticed any stereotypes or labels? Wayne, let's start with you.
The media coverage I found was it seemed to stress the negative. Yes, it's terrible to live through it. Sorry. The information provided lacked clarity. Eventually, they stopped even talking about the number of deaths because it was not good news. They didn't tell the real stories, though.
For sure. Myrna, how about you?
You know, I think in terms of people living with dementia that were in long-term care homes, I believe that they were hit so badly because there became a time during that COVID-19 where families were not allowed to visit, where there was very little sort of conversation with anybody. Even the staff didn't have time to come and sit for 15 minutes and ask how somebody's day was. And I don't think that the news media does any help by always sort of showing people with dementia at end stage. So it's really a rolling ball.
For sure, definitely. Now, what is stigma of dementia? Stigma refers to any negative attitudes or discriminatory behaviors against people living with dementia, just on the basis of having the disease. When a disease is very common, like dementia, but poorly understood, it's easy for myths and stigmatizing attitudes to spread and reduce the quality of life. Some examples of stigma include having fixed ideas or making judgments, or ignoring people with dementia and treating them as inferior or invisible. In 2017, a national survey in Canada found that almost 50% of people would not want others to know if they had dementia. So why is stigma so important? Stigma of dementia can lead to social isolation, depression, anxiety, decreased quality of life, elder abuse, and it can delay a timely dementia diagnosis. However, we know that a timely diagnosis allows people with dementia to connect with support services, make future plans, and access pharmaceutical treatments that may enhance quality of life. Also, research shows that stigma has contributed to limited access to health information, medical services, and treatment options during the pandemic. Now, despite this knowledge, little discussion focuses on addressing stigma of dementia, and especially in the context of the pandemic. And now I would love to hear from our panel of experts about why do you feel that stigma is an important issue, especially during the COVID-19 pandemic? Wayne, let's start off with you.
Well, I think that the biggest problem is people need clear, concise information, not the hype or misinformation from movie stars and whatnot that don't really know what they're talking about. They take the stigma and the misinformation and spread that. People need to know exactly what's going on and what it's all about. In order for them to deal with the stigma and maybe prevent it in some cases, get the real story. Talk to the experts that know what they're talking about.
Myrna, do you have anything to add?
Just that there's so many of us that have dementia that want to share this message. And I think we need to find a way for people with dementia to be respected enough to have the opportunities to speak in public and inform people of what it really is when one is diagnosed with dementia.
Definitely. And now, so our research objective was to examine Twitter discourse on stigma against people living with dementia during the pandemic. Now, for those of you that don't know, Twitter is a social media platform on the internet where people can share their opinions, statements, and concerns, etc., in posts that are called tweets. For our methods, we use the Get Old Tweets application in Python to collect tweets on Twitter from February to September 2020. Once our data was cleaned using filters, 1,743 tweets were included in our stigma-related thematic analysis and divided amongst 13 coders. Now, each tweet was coded independently by 2 reviewers to ensure intercoder reliability. And working in collaboration, our key themes were finalized through team consensus. Now, based on our research, 6 main themes emerged, including devaluing the lives of older adults with dementia. Now, this theme was often associated with the common assumption that people with dementia were better off dead. A Twitter user stated, "I would consider COVID a blessing if I was in a care home. They don't call pneumonia the old man's friend for nothing. A slow dementia death is way, way worse." The second theme was misinformation and false beliefs. Now, this theme really related to the inaccurate information about the vaccine causing dementia. A Twitter user noted, "Did you know that coronavirus vaccine causes dementia and homosexuality? Far worse than the virus itself. I can't support the corona vaccine and neither should you. Spread the word across Facebook." So lots of false information coming out. Now, the third theme was political ridicule. Now, this theme was related to dementia-related slander used to spread rumors and gossip about politicians, especially during the American election. A Twitter user shared, "To be fair, Dementia Joe thinks he's running for the US Senate. Do you really think America is going to elect a cop-hating socialist crook with dementia over a man who built the greatest economy since Reagan before COVID?" And the fourth theme is stigma in healthcare and long-term care organizations. This theme described reduced quality of care. A Twitter user stated, "Educate myself about it. I work on the front line in an ICU. Do you want to be an 85-year-old dementia patient with ulcers and bed sores pissing your diaper every day? The COVID virus was a blessing to those people whom, by the way, were the majority of the deaths occurred. GFY." And the fifth theme was blame. Now, this theme related to the need to blame others and was often tied to the economy. A Twitter user asserted, "Only COVID deaths in New Zealand are 80-year-old dementia patients with multiple health issues. No logical reason to destroy the economy for this. What else is going on?" And the last and final theme was challenging stigma. Now, this theme focused on people who challenged these negative stereotypes and messages of stigma and really advocated for people living with dementia during the pandemic. A Twitter user shared, "It really feels like a portion of the population we're not supposed to care about their deaths. They're less worthy or disposable somehow. I imagine someone with dementia or terminal cancer also suffering with end-stage severe COVID-19, and my heart breaks." Now, based on our Twitter findings, we found that stigma of dementia during COVID-19 was often associated with ageism and devaluing the lives of older adults, the need to blame others, political ridicule, and a lack of dementia education and awareness. Now, I'm really interested in hearing from our panel of experts about these findings and whether this resonates with them. Wayne and Myrna, how do you feel people with dementia have been treated during the pandemic? Wayne, would you like to start us off?
Sure. Again, effective and comprehensive education for all stakeholders. That is the people with dementia, the people, their caregivers, the professionals, everybody involved, the care workers, everybody. They need to understand and have some sensitivity, compassion, and respect for people living with dementia and their caregivers. Learn about cognitive reserve.
Myrna, would you like to add?
Not too much to what Wayne has said. Stigma is real. Stigma for people with dementia and even their caregivers is such a difficult problem to deal with. It can be conscience, soul crushing, a confidence turnoff, isolation seeking, So it's so important to what Wayne said about communicating, educating, and staying involved.
For sure, definitely. And now we feel that knowledge translation and sharing our findings is a critical part of our research, especially in helping to reduce stigma to support dementia awareness and knowledge. And so I've included a few examples of innovative ways that my team's been working to share our findings. For example, we've used traditional methods of knowledge translation, such as this journal article that my team published in Embrace Aging. My team has also been very fortunate to have some of our Twitter research on stigma published in the World Alzheimer's Reports, Chapter 2021. Most recently, I've been co-hosting and developing a podcast series with the Gerontological Society of America, and I've had the opportunity to share some of my team's stigma research through this innovative platform. Now, I know that our panel of experts are also doing some innovative actions to reduce stigma, like taking part in our webinar today. And so I'm really interested in listening and hearing from our panel. Myrna and Wayne, what actions do you think are needed to support education and really reduce stigma?
I think it needs to come out of the long-term care homes. For a matter of fact, about 90% of people in long-term care homes and retirement communities have some sort of a cognitive difficulty. And it shouldn't be something that we're ashamed of. To many of us, it's a way of life. It's my way of life. I deal with having a dementia and I work hard at trying to find ways to solve it. So it just comes back again. It's how to communicate, how to educate the public, for people involved to stay, for people who may have a dementia and caregivers, they need to stay involved in whatever they loved to do before, because they can still do it.
That's right. It's all about, the idea and getting it out there and the education that people with dementia can live well, for sure, definitely. It's all about that education and awareness component. So important. Wayne, I see you nodding your head, so you agree here?
Yes, I agree with what Myrna just said. Get educated with regard to dementia so you can correct the misinformation, stigma, myths, ageism, etc. Show compassion and understanding for people living with dementia and their caregivers. People living with dementia cannot change. The dementia takes over. So we as caregivers have to make that change. We have to adjust accordingly so that we can take care of them properly and give them the respect they deserve.
All right, so to wrap up our presentation, we believe that addressing stigma is essential to improving quality of life for people with dementia and their care partners. Understanding how stigma manifested during the pandemic deepens our understanding of stigma. In moving forward, further research is necessary to examine the contributing factors and interventions to reduce stigma of dementia during the COVID-19 pandemic and beyond. Now, in closing, I'd like to invite each of our guest panelists to share a takeaway message about stigma of dementia during the pandemic. Now, what advice would you share to help someone overcome issues of stigma?
Well, again, I keep saying about education. Understand what it is. There's different types of dementias. They all react differently. Two people with the same dementia will react differently. Learn about it so that you can effectively help the person and communicate. Some people are nonverbal, so you have to learn how to communicate with them in those circumstances. Some people have hearing problems. You have to learn you have to be educated and learn how to deal with that, how to help them. Remember, they can't change, we have to.
Myrna, anything to add?
Just during COVID-19, it was such an unusual occurrence that it almost forced isolation on the general public. And now that COVID is over for the most part, we just need to get back into our involvement in our societies.
For sure, definitely. That's so important, that social interaction, it's just essential. And now I'd like to acknowledge my fantastic research team members from the Canadian Consortium on Neurodegeneration in Aging, Stigma and Social Inclusion Working Group, and the Dementia Advocacy Canada group that helped to conduct my Twitter research on stigma of dementia. Also, thank you to our funders. This work would have not been possible without the support of the CRC program, CCNA, and several partners, including SHRF, Centre for Aging and Brain Health, and Alzheimer's Society of Canada. And here are some great examples if you would like to learn more about dementia. We have the Alzheimer's Society, the Mayo Clinic, and also CCNA there at the bottom. Now, if you have any questions, please feel free to reach out and contact me at jbacsu@tru.ca. Thank you for joining. All right.
Thank you. And would any questions you have, please type them into the chat for the speakers. And I have one so far while people are thinking of any other questions they have. What is cognitive reserve?
Well, cognitive reserve is a number of elements. It's proper diet, proper exercise, and very importantly, social connectivity. That's getting out there and talking to other people, people with dementia, people without dementia, caregivers, but getting out and talking. If you're talking to people, you're learning, and you can learn from them maybe different strategies on how to deal with situations that you're having a problem with as a caregiver. There's also, as I say, cognitive reserve is extremely important. It's something that the researchers now are starting to focus on much more.
I think too, that highlights the importance of neuroplasticity and the idea that we can improve our brains, and there are things we can do to really support our cognitive health. Recently, I believe it was Livingston published and co-authors published an article in the Lancet that talked about 12 modifiable factors that we can do to support our cognitive health. And so I think that that's really interesting. Just simple things like physical activity, eating well, trying to reduce our stress load. And so I think all of those things are so important.
It's not only for the person living with dementia, but also the caregivers, because caregiver burnout is a real thing.
Yeah, that's such an important issue.
And so much burnout, especially during COVID and after, right? There's no...
Yeah, reduced services, reduced supports, in some ways restricted, some ways completely terminated. And in some countries, you know, the lockdowns just continue for months. And so interesting. And even as researchers, we weren't able to, you know, go out into the communities. And so that's what was so innovative about being able to kind of pivot our research and switch over to using social media and, you know, seeing what's happening out there and being able to listen to voices that way.
And do you think of, sorry, Wayne, go ahead.
Oh, I was just going to say, I know my wife was in long-term care and I was in supported living in the same building. We were incarcerated, as I call it, for 3 months. And I stayed with her in her room, even though the staff said I wasn't supposed to, but my wife was nonverbal. So again, I had to interpret what she needed for the staff. So communication is extremely important, but there's different levels of communications. It might even be taking up sign language if that's what the person needs. Like, you've got to do what you have to do to help them, because again, they cannot change the way they're feeling. They cannot change the way they're acting because the dementia takes over. So we have to remember that we have to change and adapt.
Yeah, thank you for sharing your story, Wayne. You know, so many people I think are in similar circumstances too, you know, with the pandemic and situations that they've experienced, either being able to spend time, you know, with their partner, or else in some situations being locked right out of the care homes, which was a completely, you know, different experience. Again, so many diverse stories to learn from.
And you can see how there's so much like with the communication, the different levels and awareness of it just isn't out there. Do you think that there's other ways to bring that forward? Like, I'm trying to think how to connect it with the community, but like having positive Twitter messages going out or using social media, Facebook. You know, Interior Health has its own, like if they were doing like an education sessions where they put out like postings, like on even like pieces at a time, like, you know, sections are focusing on things to get that positive side of it out, because I can understand the ageism and people not understanding, and it just like connects it to all the negativity. And
well, and that
and
was that really came across on social media, was there's this really strong focus on the end of life stage of dementia. And I think Myrna's highlighted throughout her presentation that need for education and awareness around the fact that it is possible to live well with dementia. So often, too often, we only hear that one side.
Yeah, it's you're living through. Yeah, exactly. I have a question from Paula. Thank you for this presentation and the cognitive reverse explanation and the importance of communication. Wayne and Myrna, is there something you'd like caregivers should know about the journey of dementia? Like anything you could tell caregivers about their journey?
There are a variety of ways of getting information that is reliable. Unfortunately, sometimes if you're going to the web for information, it may or may not be true. So you have to be very careful as to what information you're getting. But there are organizations, I know in Alberta, we have Caregivers Alberta, there's Caregivers Canada. They produce various courses in McGill, McMaster's. They all provide different courses that people can take at no cost on your own time and learn about dementia, how to communicate, how to deal with difficult situations. There's a course that I took even coming out of University of Tasmania in Australia that is very good. So there's a variety of sources. If people are interested, like I say, they could email us and I'd be happy to share those, the resources for them so that they can take a look at which one works for them and suits their lifestyle, their time format, etc. But again, at different levels of dementia stage, you need to know how to deal with the situation. Because again, it changes. It could change hourly, could change by minute. And unfortunately, people with dementia can sometimes fool a caregiver into thinking everything's fine, they're okay. You know, even medical doctors have been fooled into thinking the person with dementia doesn't have dementia. Because for a short term, they can do that, but not everybody. So the more you learn, the more you understand, the easier it is for you to deal with them, to work with them, to help them, to be compassionate and understand, but also the less stress you get and the easier it is to get rid of stigma, because now you understand you have the information you need to deal with it. Without that information, it's a real struggle. Myrna, what do you think?
You know, I think sometimes people with dementia and caregivers need to align with their communities to build services for people living with dementia and caregivers. In my city, we have a group called Purple Angels, and it's over 20 people. Half of them are caregivers, the other half are people living with dementia. Interestingly enough, I'm the only female, all the rest are men. Which kind of talks about a current note that is out there. I have something to say. I was recently invited to a rather large fundraising event. And so there were many people on stage talking about fundraising and how best to assist people with dementia. There were two caregivers talking about what kinds of things they've had to undergo because they love somebody that has dementia. And I was absolutely dumbfounded that there was not one person with dementia on that stage. When somebody is having a fundraiser for people with the lived experience, they need to ask a person with dementia to speak on that behalf. That would certainly help increase the dollars of the fundraising event. I feel that what happened at the event that I'm speaking of I believe people with dementia were stigmatized. And I'm not about to take that sitting down. I've been stigmatized a couple of times, and I must stand up for myself.
100%, definitely, Myrna. And you say it so well and so eloquently. You know, lived experience. There's just such an important need for lived experience of people with dementia and insight into research. You know, too often still we see studies being done without any consultation or anything with people living with dementia. Also care partners, are still being excluded. And so I think the more that we can educate and get that awareness out, that lived experience and that firsthand insight is so important. And I think that helps ensure too that we move away from stigma. You know what I mean? It's giving the real story out there instead of, and the diverse study out there. People have many different journeys living with dementia. It's not that end of stage all the time. There's, living well. And so I think the more we can spread the message, and I think, you spread the message best, Myrna. It's just, you need that, the lived experience. It's just such a valuable.
Totally. Always there. Definitely. I can 100% see that.
Well, the interesting thing is, even though I was caregiver to my wife through the terrible journey, she was nonverbal, so she couldn't exactly explain what she was going through or the problems she was having. But because I'm a member of EPLID with Myrna, I get to hear from Myrna and others that have other people that have dementia, and I get to see their perspective, which is very informative. And as Juanita said, Myrna expresses it very well. Both of us are involved with a lot of projects that spread the word and try to make sure that there are different aspects to dementia, along with the different types of dementia, but you can live well with it. I agree with Myrna.
I also want to point out that a lot of people with dementia don't want to relearn something. They just want to have fun. They want to go out to dinner. They want to go fishing. They want to go bowling. They want to go down to the park and go for a walk. So set up a group in your own neighborhood and just have fun. Be social. That's what people with dementia want.
Right. Not just like, here's some tasks for you to do and work on. You just enjoy and be social, and whatever you feel like doing, you should be able to do. Yeah.
Yeah, that social component is so important.
Yeah.
It really is. Especially, enhancing quality of life. Too often we still see people that kind of try and hide from the world a little bit, especially in the rural communities that I'm working from. They're scared, they don't want to be shunned. There's such a stigma with dementia that, they're scared to share their story. And so they end up kind of sometimes having that kind of social isolation and that exclusion. And so I think the more that we can get the awareness and the education out, that you can live well with dementia. It's okay. We don't have to have the stigma around it. It almost seems like mental health. 15 years ago, everyone felt so uncomfortable talking about mental health, sharing their stories. And now we see, there's real champions that have come forward talking about mental health, and people are so much more comfortable. And so if we could get to that point with dementia, I think that would be truly, just such an accomplishment.
Wow, I certainly agree.
I'm with you. With you.
That's great.
Yeah. I'm going to catch a couple of these questions so that we can pass them on to you. From Amy Jo, would you have any recommendations that us as a facility could put out to the families to help them better understand dementia and its stages? Something that they could share from the long-term care home itself to the families.
I see in the chat, someone just posted the Tasmania course. And so that kind of helps answer that question there. There's always new courses coming out too. I know U of T once in a while offers a course as well that's open to people living in the community. You don't just have to be a researcher to take the course. And so it's great to see that there's more resources coming out.
And Jaquetta would like to collect the resources for the page. They can put on the Embrace Aging page. And so the ones that you recommend or you're aware of or that you've used, we should send them to Jaquetta and she can put them on for everybody to see.
That'd be fantastic.
I think it's also really important to understand that caregivers have to deal with stigma as well. It's not just those of us with dementia, it's caregivers. And so doesn't it all come back to we need to live in a kinder, more understanding country? We just need to care.
Yeah, that caring aspect's so important, just that dementia inclusive communities, you know, more research there. How do we go about creating it? And so much of it is Myrna, like you said, around just being a more caring and inclusive kind of environment.
Mm-hmm.
Oh, Chiquita will share them on the website. I've noticed too that maybe since COVID and beyond, that there's not like in that community space when you're going to the clinics with your care, the person is with dementia or their family members taking them, that the signage and everything like that dementia friendly communities that you're talking about is really, I don't see it there as often as it could be in different places. And I don't know if there's a way to push that forward in some way. It seems like there's certain areas I've done that. Maybe Calgary has, I've heard of it in a few places, but why isn't it more like part of the cities and the towns, like in their development when they're working on all these different, because it's, I see it, I live in a place where there's different clinics around and people aren't, you know, it's just very confusing. The parking isn't set up, the way you pay isn't set up, like it's just not friendly for anybody else unless you're within a certain age and, you know.
It's not only that, it's also things like colors are important. People with dementia, if there's a black color on the floor, like a carpet, they think that's a hole in the ground. So they won't step in it. If it's blue, they think it's water. So there's things like that have to be considered in the design issues. I know I was involved with a project with HSO, Health Standards Organization, redoing the long-term care standards for Canada. And a lot of the aspects there that came out, I wasn't aware of and never thought of till I was working on that committee. And we redid all those standards, which were released, I believe, in early February. So that's something else to take a look at. And if you have to place a loved one in a facility, check to find out if the facility is following standards like that. I'm sure BC has theirs. I know Alberta redid theirs. So the standards are there. It's a case of whether the facilities are following them and whether or not they're cognizant of some of those issues. Like color is important, very important. I mean, I've seen people where my wife was, that there was somebody dropped a piece of paper that was black on the carpet and they'd walk around it. And I was thinking to myself, why are they doing that? And I thought, okay, well, maybe they don't want to trip. And then I realized, wait a minute, it's the color. They think there's a hole in the ground. So unless you're aware of these things, how do you deal with them? So a lot of it is getting that information out there and not listening to the hype and the BS, I call it, from, you know, movie stars and whatnot that have no clue as to what they're talking about. And they're just hyping the stigma. They're just making it worse. I mean, look at Bruce Willis now. They found that he had dysphagia, and now they found out it's frontotemporal dementia. So again, it's, you know, there's people out there that do champion things. Unfortunately, he's not able to champion it, but there are other people, various aspects of dementia that are out there. You just have to get in touch with them, or, you know, read the materials that they're putting out, or join groups, as Myrna said, form your own groups if you have to, but just get that social connection out there, because that's a very important part of cognitive reserve. If they don't have that, there's no stimulus. I saw people just wither away because we were on lockdown. The only contact they'd have is HCAs for, you know, 5 minutes a day sort of thing. Maybe a little more, maybe 15 minutes. And no matter how good the HCA was, it was only 15 minutes in a whole day. Like very limited time, very limited contact.
Right.
You need that. You have to build that. but you can build it as communities. As Myrna said, you can get a group of people together and just go for a walk and just have a chat. I run 4 conversation cafes, 2 with people for dementia and their caregivers, and 2 specifically for caregivers. So the conversation cafes, or some places call them memory cafes, those are places where you can go and talk with people that have the same or have similar experiences or are going through the same experiences, and you can share ideas. We have a lot of information coming out of the conversation cafes. There's 6 or 8 now in Calgary, and we all share, all of the moderators, all of us share information that we gain.
Mhm.
Go ahead, Myrna.
I just want to share a really exciting thing that moved me to tears a couple of weeks ago. In the gentlemen that are part of our support group, we have several who are nonverbal, and we have one gentleman who talks incessantly. We had an event, and I had all the men sit down at a table. They chose their seats, and I got them to play X and O's. Little did I know that many of them couldn't remember to play X and O's. So I asked one member of each couple of gentlemen to teach the other one. This is actually mind-blowing. My gentleman that is nonverbal had the best conversation with the gentleman who cannot stop talking. For 1 hour, they shared their voices with each other. Can you imagine how fulfilling that was? And we met again yesterday, but it was gone. But for that 1 hour, those 2 men had the best experience in years, just by giving them the opportunity. You know, it doesn't always work, but every once in a while it will. And to me, that was the biggest gift.
Yeah, that's an amazing story. That's just so incredible. It's so like uplifting, just that whole, notion of hope too. And just that idea that it doesn't have to be a major intervention. It doesn't have to be a major activity. It could be something as simple as, X and O's and self-teaching, and just having that opportunity to connect with someone else. I love that story, Myrna. It just makes you feel, so fantastic inside.
Yeah.
Totally.
Yeah, and the
That's
conversation
beautiful.
a fantastic way, and just incredible. 6 to 8 different cafes happening right now. I'm thinking about the rural communities that I do a lot of research in, and just listening to your ideas and how can I bring that back into some of the communities that I work with. Just so fantastic. Every time I get to hear with you and spend time and connect with you, it's just been such an opportunity.
Well, one of the ideas we gained from one of our members was his wife has a palliative care nurse, which is pretty sad to hear. But he was saying the nurse said to him, as a caregiver, what you have to do is when you get up, you have to take all of your emotions, all of your ideas, all of your thoughts, put them in a box, put that box away. Today, you're a caregiver. That's all you do. So you don't think about anything else but caregiving. At the end of the day, when your person has gone to sleep, then you pull the box out and deal with what you have to from the box. But put it in a box and get it out of the way. Because really, that's how you can deal with burnout. I know myself, I was burnt out and I didn't realize it. My own daughters had to come and say, Dad, you're getting burnt out. You got to take a break. But I mean, I knew my wife for 50 years. We were married 48. What else would I do but to care for her? I mean, that's all I thought about. But because I concentrated just on that and not thinking about, well, what happens if I get sick or something happens to me, how she can be cared for? Again, she was nonverbal. So, I mean, somebody who didn't know her would not be able to interpret as well as I did what she needed. I mean, I was with her for 50 years.
Yeah, that's such an important
Yeah.
thing. Care partner burnout, you know, that's so huge, and making sure that you're taking time to kind of also take care of you. And especially like some of the stories, I know I was at a community meeting about a week ago, and just hearing the stories again, how it's 24/7, you know, they're sundowning at night. And so how do you find that balance to kind of preserve yourself and, you know, kind of also take care of yourself? And so I think, yeah, what you raised is just so, so important, Wayne.
But plus the person with dementia also needs that other social contacts. So seeing the same person all the time, that's not really to their benefit as well. They need that interaction with other people. So while you're getting your respite, so you can prevent your burnout, you're allowing someone else to converse, talk, socialize with them. So that's good for them as well.
It must be such a difficult job to be a caregiver, and it's not a job, it's a, whatever the correct word is. I know my husband must pull his hair out at times when I can get quite difficult to deal with. But when I see in our groups the caregivers and the people living with dementia separated, and the caregivers can talk and solve problems between themselves, it's such an uplifting situation. So many of the support groups are either the caregivers or the people living with dementia. And if you're a caregiver, you cannot bring the person with dementia that you're in charge of.
Oh, wow.
And so you cannot attend those meetings then. So I think combining is such a wonderful way to go.
Yeah, definitely, 100%.
Well, everybody has something to share. And if they're given the opportunity, it's the other benefit is by knowing that you're not alone. There's other people that are in similar situations, and they can give you some ideas, strategies to deal with. I know here in the facility I'm in now, they have a few people with dementia, early stages. So it's a little different, but I was involved with training the care staff here on how to deal with them, how to work with them, how to recognize potential problems, or what I call situational awareness, because sometimes the trigger is not the person themselves, it's something else. It's maybe somebody else. So to watch for those kind of things and kind of cut it off before it happens. But music also, music is extremely important. The scientists tell us, or the researchers tell us, music is one of the last memories that people with dementia lose. My wife was a good example, nonverbal. If I played music for a song that we used to play when we were driving, she would start singing.
Oh, wow.
She was nonverbal. So it's like, wow. You know, she wouldn't talk to me. Maybe she didn't want to, but she would sing. She would sing a song. And that was just phenomenal. But again, that's what the researchers are telling us. So again, by learning as much as you can, you learn these things. When my wife was first diagnosed, I knew very little about dementia, maybe how to spell it. That was about it. So I had to learn all these things. And now I'm an advocate and involved with 6 universities across Canada, 2 outside of Canada. I'm almost as busy as Myrna is.
Yeah, it's incredible. It's incredible the work that you do, both of you advocating for dementia. It's just amazing, just completely invaluable.
I think it also needs to be said that the government is beginning to step up and add some more funds to researchers such as yourselves. And there's a lot more research happening. Unfortunately, it's really difficult to get people living with dementia to participate in research. And we can't go forward without that. It really will make a difference. I think it comes again back to that terrible word stigma. And so we need to work even harder to get that overcome.
And it is important to have people with dementia involved, because as I said, sometimes you don't have the right perspective, or they provide a different kind of perspective as to what some of the issues are that you don't really think about as a caregiver, but the person living through it can explain it to you, and you get to understand better how to work with the person, your loved one.
This has been a really lovely conversation. I think all four of us have added important things for those of folks that are watching or going to be watching. I think what it says mostly is don't be afraid to ask. People with dementia are happy to share, as are caregivers, as are researchers, and as the government is beginning to put up more funds to help us through all of this. Thank you for allowing me to be involved in this.
I echo that sentiment. Thank you for allowing me to spout off.
I just want to sit here listening to you all day.
Yeah, this has been such a great opportunity. We really appreciate it. And the Embrace Aging event has been such a great opportunity, a month long of learning. How fantastic. I love it.
We want to thank you as well, Juanita-Dawne, Myrna, Wayne. This has been really amazing, and everyone else who's attending this webinar, and I'll be looking forward to and sharing the YouTube wherever I can. And I will a lot. We encourage everyone to attend other events scheduled for Embrace Aging as well across the month of March. And our Jaquetta, if you want to type it in while I say it, please visit the website, Okanagan Embrace Aging.com, for all events and registration, because no one will write it down when I say it. And
Well
thank
done,
you
well
so
done.
much. Thank you. And thanks, everyone. And we'll be talking again, because I'm going to talk to Juanita-Dawne, and we'll talk about other things as well.
Bye, everybody.
After this.
Thank you so much for attending. Bye-bye.
Thank you for attending.
Thank you.
Thank you.